Hey guys, what's going on? Erika Leigh here with Eleight Massage Therapy. I'm a PTA licensed massage therapist and strength and conditioning coach. In this video, I want to go over how you're going to treat your own plantar fasciitis. All right, let's take a look. All right, so we're going to go over what a lot of people face all the time, I know, and it's foot pain. Especially if you're a runner, walker, or maybe you've just started, switched your shoes, maybe you don't have very good footwear right now. But plantar fasciitis is something that I know affects a lot of people. I have a lot of people coming in the clinic all the time just for this. And what it is, let's go over that real quick, and the muscles that we're going to address. So the plantar fascia is obviously the fascia, the connective tissue at the bottom of your foot. What that is a continuation of the tissue from the calf, the gastroc, the soleus, on down to the Achilles, which then wraps around to the bottom of the foot, creating this fascia connective tissue chain. Okay, so we want to address not only the foot, but also the muscles above as well. Now, occasionally, some people end up with a tendinitis, and this is also where you might see people get a cortisone injection. Maybe you've experienced this yourself, of this tendon that comes and hooks right below the inner ankle bone, right kind of at the heel. So what that is a continuation of this muscle up here called the posterior tibialis. So we're also going to be treating this muscle that runs this way as well. But first, let's check out the calf. Give it a little shake, warm the tissue a little bit. This is what you will see in the clinic. Because if you go in and do something deep in a tissue, it's going to be pretty painful. So I like to take a little bit of time to just kind of, do a little bit of compression with my hands first, just to get the tissue warm. Two things you're gonna need are a tennis ball and a golf ball. Right now, we're just gonna start off with a tennis ball. Okay, so I got mine right here. So what you're gonna do is place the tennis ball kind of just below the knee at the start of the gastroc, at the start of where the meat of the calf is. And all you're gonna do then is kind of work the golf ball, and you can adjust it. If you're strong enough, you can glide yourself, pull yourself back and forth. Now what we're doing here and what we're looking for is a tender spot. So these are maybe some knots in the muscle. I'm just going back and forth with the ball. Once you find that spot, get on it, stay on it, and you're gonna use your foot now. You're gonna use your ankle, move it up and down, and what we're doing is helping to separate the fibers there. Do a couple circles, maybe change the angle a little bit, go onto your side. Again, use the foot, use your own motion to help relieve whatever pain it is that you're having, okay? So that's gonna be working the meat of the calf, the gastroc soleus. Now, to get into this, I'm just gonna show you an opposite leg because it's easier. Get into this posterior tibialis here. You're gonna kind of roll onto your side. So you're gonna roll towards the ball, onto your side, and we're gonna do the same thing. Kind of rock back and forth, maybe move the ball a little bit till you get that hot spot. Then we're gonna move the foot, pump that foot up and down, do some circles, and that will help to break up any restrictions in that area. Now again, some of this is gonna be a little bit uncomfortable. It might be a lot uncomfortable depending on how severe it is, but the more you do it, the more frequent that you're able to do this, the faster results you'll have. So now we're gonna take a look more at the bottom of the foot. All right, cool. Now we're gonna check out the bottom of the foot, which is where most of the heat is, right? A lot of people will have it at their heel. Maybe you have a little bit at your heel, or perhaps it's more along the arch of the foot. Either way, we're gonna get at it using both a tennis ball and a golf ball. All right, so I know a lot of people like to use a frozen water bottle or something like that, because yes, it is an inflammatory issue, but the water bottle isn't going to be as specific at targeting a point that you want, okay? So if you're at home and chilling and you got that ice bottle ready, cool. But if you might be at the office or just throughout the day, keeping a tennis ball or a golf ball is going to be much easier for you to do. Okay, so all you're going to do, place it at the bottom of the foot, start at the heel, turn sideways here so you guys can see, start at the heel, and kind of just put some pressure downwards. And again, feel for where those hot spots might be. This motion, you know, it could be, you could just be sitting here doing this throughout your day. You can do this standing. I mean, you're able to control the pressure. So you go as deep as what you're comfortable doing here. More specific, taking the golf ball instead, again, working around the heel and moving towards the toes. And this is going to be maybe a little bit more tender, but again, if we're looking for, you know, trying to release a certain area, this is going to be much more specific and targeted to that tissue. Let's look at a seated stretch, real easy to do. More, again, targeting the bottom of the foot. What you're going to do is place your toes down, try and raise your heel up as high as you can get that heel. What we're doing with this is stretching more so the toes, right? So we're pulling the toes, getting a good stretch with the toes, so the tendons and the connective tissue at the bottom of the foot, more specific here. And you can, if you get your foot a little bit further back, raise your heel up as high as it will go. That will really get you more of that targeted stretch. All right, so now we're going to go over a few standing stretches for you to do, and you can do this anywhere. You don't need any special equipment. Now there's two parts of the calf, right? So you have your gastroc and your soleus, which makes up the meat in the back of your calf. So the first one is going to target your gastroc. What you're going to do is stand with the affected leg back. So you got plantar fasciitis on the back leg. That leg goes back. You're going to push down into the earth. Push down into the earth. Keep that knee straight. You can do this at a wall, at a table, at a chair, if you need the extra support, but you're going to lunge slightly forward until you get a stretch. Now the stretch should be felt right below the knee. You know you're doing it right when your knee is straight, your heel is down into the earth, and you got a little bit of a stretch right behind the knee, just below. Now the second part of this is going to be more for targeting your soleus and your Achilles. So if you got more heel pain, or if you have a little pain around your Achilles, you're going to want to do this one for sure. So again, you're going to assume that position, back leg, affected leg to the back, bend slightly forward. This time, as you're pushing into the earth with your heel, you're going to let your knee bend. So you're going to slowly bend until you get that stretch more in your Achilles now. So you should feel this right above your heel, more so in your Achilles muscle. Okay, so these two stretches, you're going to hold them for about 30 seconds to a minute. If they feel good, come back and do it again tomorrow. Okay, so the more you do these exercises and stretches, the faster you're going to see your own results. And guys, if you really enjoyed this video, make sure you check out my other videos. There's even more that goes into dealing with plantar fasciitis. Sometimes we also have to look at the hip. Internal rotation at the hip, a little weakness, tightness in the hip, and you can see what happens at the foot and ankle. So if you've got that going on, you want to make sure you also check out the hip video. I hope you have a wonderful day and make sure you're treating yourself well.